Hello and welcome to the official YouTube channel of Lema Dental Clinic here in Istanbul, Turkey. Have you ever wondered what exactly happens during a professional teeth cleaning? Before the cleaning begins, your dentist or dental hygienist will start with an initial examination. This includes checking your gums, teeth, and overall health. They'll look for signs of tooth decay, gum diseases, or other issues that might require attention. If necessary, x-rays may be taken to check for problems beneath the surface. This helps ensure that the cleaning is safe and any underlying issues addressed during the process. Plaque and tartar removal. The first major step in cleaning process is removing plaque and tartar buildup. Plaque is a sticky film bacteria that forms on your teeth, and it is not removed by brushing. It hardens into the tartar. Once tartar removes, it can only be removed by a professional. The dental hygienist uses a special tool called a scaler that gently scrapes away the tartar on your teeth, particularly along the gum line between your teeth. This part is a process essential because plaque and tartar can lead to gum diseases and cavities if left untreated. Professional tooth polishing. Next, your dentist, your hygienist will move to a polishing teeth. This step involves using a special polishing tool that spins a small, soft rubber cup with a gritty paste. This paste is designed to remove remaining plaque surfaces and stains. The polishing gives your teeth a smoothly, shiny finish and helps prevent plaque from accumulating quickly. It is part of the leaves that teeth feeling super clean and smooth. After polishing, your hygienist will floss your teeth. Flossing is an important part of cleaning process as it helps remove any debris, plaques left between your teeth, areas that even toothbrush and scrapers may not reach. It also helps hygienists check any signs of gum diseases or areas where you might be at risk for cavities. If you don't floss regularly at home, this step helps reinforce the importance of floss as part of your daily oral routine. Rinsing and fluoride treatment. Finally, the cleaning ends with a rinse. You will typically rinse your mouth with a special fluoride solution, helps remove any remaining debris and protect your teeth. Fluoride is important because it strengthens your enamel, making your teeth more resistant to decay. In some cases, your dentist may apply a fluoride treatment for extra protection, especially if you're at a higher risk for cavities. This treatment can last for several months, helping to keep your teeth strong and healthy. Why regular cleanings are important? Regular professional cleanings are essential for maintaining optimal oral health. They remove plaque and tartar that brushing and flossing at home can reach, preventing gum diseases, cavities, or serious oral issues. We recommend seeing your dentist every 6 months for a checkup, cleaning to keep your smile on top of shape. At Lema Dental Clinic, we provide through a gentle cleaning tailored to your unique needs, helping you achieve a healthy and beautiful smile. So now you know exactly what happens during a professional teeth cleaning. If you're due for a cleaning or have any questions about your oral health, don't hesitate to contact us at Lema Dental Clinic. We're here to help you keep your teeth clean, healthy, and bright. And if you found this video helpful, please like, subscribe, leave any questions or comments down below. Thanks for watching, and we will look forward to seeing you soon.